Good afternoon. Today we have a pleasure of having conversation with Dr. Michelle Weddle. Michelle is my long-time friend, and we are gonna talk about pediatric sleep dentistry or pediatric sleep apnea, as well as tips for the good night sleep. I'm gonna give a short introduction about Michelle. Michelle is a general dentist and she practices orthodontic and general dentistry, as well as she is a great dancer. And additional to that, she's a mom of two beautiful children. And she also organized a wonderful pioneer system called ASAP Pathway. It's a management system for general public as well as dentists to find information about pediatric sleep apnea. And today you're gonna find a lot of useful information. And please put your questions in the chat. We would be very happy to find the answers for them. Welcome, Michelle.
Thank you so much for having me, Marina.
It's such a pleasure. I'm gonna give you a short story how we met. We was in the same, it was many years ago, we were in the same residency program in New York, Beth Israel, and we connect on some conferences because every conference I attend, Michelle was always there. And we took a mini residency or I would say residency program about orthodontics, and I remember so clear our conversation about malocclusion, about bad bite. I was wondering why so many people don't have a good bite. What can be the reason for that? And I was so puzzled, why every single child needs braces. And then our conversation led to the problem with sleep. And Michelle mentioned dental sleep medicine. And now I've been practicing dental sleep medicine for 12 years, and this is the person who I have to really thank for that. Michelle was my inspiration. And, thank you very much.
We talked about that idea, we talked about the topic, but all the work was all yours. And, so you talk about how I inspired you, but you're the one who inspired me to get my board certification. I wasn't really even thinking about that. But thanks to you, I am board certified also in dental sleep medicine. And I would never have undergone that if you weren't right there along with me studying and, and taking
No,
the
I
tests.
remember how we did it
Yeah,
together. Yes, thank you very
yeah.
much. I guess it's always a team effort, just like this world of dental sleep medicine, pediatric sleep medicine. It takes more than one person to find a solution for such an important, multifaceted problem. And
Yep.
I just want to mention again, thank you very much to our audience. We have some questions in the chat, and we're going to definitely get to the answers. But first of all, before we start answering the questions, I would like to ask you, Michelle, as a pioneer in that ASAP pathway, which I find as a very useful resource as well, please tell me, how did you come up in the world of pediatric sleep? Like, I came to my world because of you, but tell me how you come to the world of pediatric sleep.
So, as you know, I started in the world of adult dental sleep medicine. And the reason why I got involved with pediatrics is because of my son. My son, Matthew, when he was about 2 or 3 years old, he just never slept. He didn't sleep through the night. He kept waking up. And he's my second child. So, my first child was Katie, and she wasn't like that. So, I knew that wasn't normal. Um, had he been my first child, he probably would have been my only child. Uh, but I wouldn't probably have known the difference. I would have just thought, oh, I guess this is how kids are. They don't always sleep that long. But with my son, it was very different than my daughter. My daughter slept through the night at around 2 months of age, and my son, 2 years old, 3 years old, he would wake up, he would sleep between 9 and midnight and then wake up every 30 minutes, every hour. And I just didn't know the reason. And observing him, and also because I was seeing patients in adult dental sleep medicine world, I was seeing some similarities in the presentation, the mouth breathing, I could hear him breathing. He wasn't snoring, but I could hear him breathing, and it sounded to me like it was a little bit labored, a little struggled, and he would move around a lot at night, and his bed sheets would look like he just, it was a playground or a war zone. Um, because the covers would be all over the place. His pillow will be on the ground. His stuffed animals will be just tossed aside. He would start in one position and then he would be sideways or he would be upside down. It was just different, and it wasn't normal the way I had come to know normal based on my daughter. So I knew that something was happening, and I knew that a lot of it was happening during sleep. And coming from the dental sleep medicine world, I'm like, well, could this be airway? Could this be sleep apnea? Do kids even have sleep apnea? Because I didn't hear about that. We heard about adults having sleep apnea. We
I
didn't.
like
I
how
didn't.
you put it.
I didn't learn about kids having sleep apnea. And in fact, when I started digging into it, a lot of times kids, when they undergo sleep studies, they don't have sleep apnea. So anyway, that's how I got involved with this as a mom, trying to find help for my son, and my whole family, because, the child doesn't sleep, mom doesn't sleep, mom doesn't sleep, dad doesn't sleep. It's the whole family dynamic is affected. So in my search for answers for my son, that's how I came about pediatric sleep medicine and pediatric dental sleep medicine.
Oh, this is such a nice story. Like I can visualize every single one. I absolutely love how you describe, a lot of activities at night. And, that leads me to my second question. As you know, my practice is adult people who suffer from bad sleep, interrupted sleep, tired in the morning, and they're very concerned. They're concerned about their kids. They ask, what should they do? How they should start exploration? What's the special sign? Like I know you described very well about your son, but if parent suspect sleep apnea, like if parent going through the same thing you did, like you have such a very great description, tell us what the proper steps they should take. Like, okay, just watching your son doing all this discotheque at night, that's not enough. you know
um, yeah, so as a mom, as a parent, when I had observed this in your child, when you observe something like this in your child, your natural tendency is to consult their pediatrician, and that's exactly what I did. I consulted my pediatrician because it wasn't normal for me, and I can imagine my son getting enough rest if he's sleeping like this in the at night, waking up every hour, every hour and a half. And so I consulted my pediatrician, and at that time, they had a lot of advice for me, but none of them worked. So I knew that there might be something else going on. So the first thing is, see if your pediatrician might have some ideas, and try them. And if they work, great. But if it's an airway issue, a lot of the behavior management might not work because there's an underlying reason why the child is not sleeping. So it's not just a behavior or a habit. Sometimes they say get them on a schedule, things like that. So we can try that. I would say definitely your pediatrician is a great resource. But once you've tried all of that, like I did, and it didn't work, then it's time to suspect that there might be something underlying, that's contributing to these awakenings or these restless sleep. So then the next step would be to try to video the child, and try to see whether you can find an airway dentist, a dentist who's experienced and trained in managing pediatric airway, or you can go to a sleep physician who is specializing in pediatric sleep. So not just a general adult sleep physician, because pediatric sleep is very different than adult sleep. So in many places in the country, unfortunately, there's not a lot of pediatric specific specialists in sleep medicine. So, but what you're going to want to ask is whether they manage children and whether they know the difference between adults and kids.
And we appreciate all our listeners, people who are watching us live. We appreciate Susan Rizzo. Thank you very much for your question. We're definitely going to find the answer for that. And Joshua, yes, recording of this will be available online and you can watch it and get the wisdom from Dr. Weddle, of course. And I know I would like to ask you, for my patients, for a lot of people who suspect sleep apnea, I recommend to use the Snore Lab. I know video would be great for kids. Is anything else you use in your practice to kind of give an idea? Yes, you're in the right direction. You're on the right track.
Yeah, yeah. So a lot of times because we can't go to the house, we depend on many things, and a lot of the equipment that's available is specific to adults. There is one thing that's a ring that the kids can wear, and it's FDA approved for adults and kids, and it uses technology that analyzes something called cardiopulmonary coupling. So it's a ring that we use. It's basically what we use for screening. It's a screening tool. It's made by Sleep Image, and if you have a dentist that is managing both adults and kids, 9 times out of 10 they would have something or something similar. They might have this or something similar to it. But what I like about it is that not only does it look at the heart rate and also the oxygen in the blood, which is what a lot of the adult screening tools, it's what a lot of the adult screening tools are looking for. This specific thing also looks at your restfulness, the quality of your sleep, whether you're restful or whether you're restless. In medical terms, it's classifying parasympathetic sleep versus sympathetic sleep. And sympathetic is your fight and flight, and parasympathetic is your rest and digest kind of sleep. So I like to have all of these modalities to try to combine it, because in kids, it's not always the oxygen and it's not always the heart rate. Sometimes there's other things that is going on that can be detected by the sympathetic and the parasympathetic sleep.
Yeah, this is very useful sleep image. That's the wonderful advice, because I can tell some of my adults patients have a trouble with the home sleep study, and to put something on a ring on a hand without other wires, that's really useful. And that leads to my next question. What do you think about pediatric sleep study, and can it be done at home? Because a lot of parents find that as an obstacle or challenge. And what do you think about that classification? That's also part of that question about AHI. I know we, as adults, for adults, I use that apnea hypopnea index. What do you think about, present system classification?
So the the sleep study for adults could be at home or in the lab. And for kids, there are some at home tests available, but the gold standard is still in the lab. And I know you're saying, and same thing with my patients, it's so difficult to schedule, a lot of times, because you're not only talking about the schedule of the lab, you're talking about the schedule of the mom or dad, the schedule of the parent, who's going to stay with the child, and then also the schedule of the child. So you've got schools, you've got after school activities, exams, games, things like that. So it's very, very difficult to schedule an in lab study. However, I would say that it's still worth it to get an in lab study for many reasons. So we know that sleep disorders and sleep apnea is just one of many, many, many sleep disorders out there. So sleep disorders, they happen in clusters. So a child who has some airway issues might have other sleep disorders that's occurring at the same time and contributing to their lack of sleep. So it's really good to have a diagnosis from a sleep physician who will look at everything globally and not just one thing. So for example, restless leg. So a lot of kids, they can move around a lot and they might have restless leg. So that cannot be detected with a probe study. And it also can't be detected if you're not doing an actual in-lab study. The other thing about the in-lab study is it has a lot of sensors, and it is more accurate, especially in children, because we're looking for when they're awake and when they're asleep. And the only real good way to figure out when the kid is asleep or awake or a person, it doesn't have to be a child, is to have some sensors in the brain waves to kind of figure out, is this person sleeping or is this person awake? Sometimes we know that if you're awake, you can just stay there and not have a lot of motion. So if you don't have brain sensors, a home sleep study will think that the person is asleep when in fact they're just lying there awake. So there's many things that the home sleep study does not say, and it can lead to not a great diagnosis, especially in children, because we know that children actually don't have what you're talking about, Dr. Sokolina, AHI, right? AHI is apnea and hypopnea index. So apnea is a complete cessation of breathing. Hypopnea is a partial cessation of breathing. And there's many parameters that an event has to meet before it can be classified as an apnea or a hypopnea. And in a lot of kids, the kids' bodies are healthy enough that the body doesn't allow the child to to not breathe.
I love how you put it. You know, that's true.
So the child's body is healthy, and that therefore the body senses that there's something off with the breathing, and then the child will now compensate. It'll move around, it'll wake the child up a little bit, wiggle the leg, maybe change body position, go like this. Something will change to compensate so that the child doesn't not breathe. And so you don't get an apnea or a hypopnea because the body doesn't allow the child to get there. But there are other things that the body does that now disturbs the sleep and disrupts the sleep.
Oh, this is such a great answer. We have a question from our listeners. Thank you very much, Amna, for contributing with the question. And the question is related to what you just said. But if we would like to have a home sleep study, how can we do sleep study for kids at home? I know you just mentioned, but maybe this is a great first step. If you can talk about that.
Right. So there are home sleep studies that are approved by the FDA to be used in children. And any sleep study, especially here in the state of New Jersey, has to be prescribed by a physician. And then it has to be read by a sleep physician. So if you're interested in getting a sleep study for your child, definitely reach out to a sleep physician. And if you can find somebody who's a sleep physician that specifically is specialized in pediatric sleep medicine, that would be the best thing.
Oh, thank you very much. It's such a great answer. And it brings me to the next question. As a parent, I was always concerned about ADHD because there are so many kids with ADHD. It's like become, just like orthodontics, name for our time. And medications what kids have to take to stay focused. Maybe not always kids, sometimes adults as well, but that's in general. I know you're not specializing in that, but you just talk about such an active night. And do you have philosophy about that? If you can share with us.
Yeah, so definitely. Again, like as you said, I am not a specialist for ADHD diagnosis. I'm not a physician. But if, as a parent, right? So as a parent, I know that if my child is not sleeping well, if my child is past their bedtime, or, when my children were young, when past their nap time, they're going to be a little bit more prone to emotional outbursts. They're not going to be listening. Sometimes they're going to be a little hyperactive because they want to keep their bodies awake because they're fighting to sleep. They don't want to nap. I don't want to nap. I'm awake, mommy. I'm awake. See, look, I'm moving. so, from that experience as a mom, I know what a sleepy child is like, and some of the signs that we see in children with ADHD are very, very similar. So, if you're a parent who's kind of trying to figure out, does my child have ADHD, or if your child already has a diagnosis of ADHD and you're trying to figure out whether you're going to start medication or not, what I would recommend to consider, if you haven't yet ruled it out, is to see whether sleep or airway issues is contributory to what you're observing in the child. Because maybe there is ADHD, but maybe it's being exacerbated by the fact that the sleep is not as good as it should be. or maybe it is just a sleep issue. And then if that gets taken care of, maybe we'll find that the symptoms go away or lessen severely, that, the management is very, very easy. So
I really love your answer, and it brings me to a little bit different picture of, I would say, personalized medicine. Not one solution fits all, and you have to be advocate for your own health. And there is a smaller gap between medicine and dentistry, so you have to look for answers kind of yourself and research. And thank you very much for such a great people like you who can come to this channel, what we can educate our audience, but there are a lot of solutions to one problem.
I
And
love I love what you said about personalized medicine and personalized care, because really I feel like that is what we're searching for. And if there's any kind of condition that can really benefit from personalized care, it's this airway thing, because it's such a big spectrum and not one thing fits everybody. And not one thing will work for everyone, because again, even with sleep apnea, we know that sleep apnea is caused by many things. And if in one person's particular type of sleep apnea is not always the same as another, especially in children. So this personalized approach, talking to all your providers, taking everything that they have to say and trying it out, and if it doesn't quite fit what you're observing, trying to find something else to try to see whether you can help your child.
this is great. I think it's such a great philosophy. And now I want to talk a little bit more practical. I know you have a lot of experience with orthodontics, and as we know now, what bad bite just not gonna come accidentally. What people end up with crowded teeth or bad bite, it's usually a result of breathing difficulties during the day or during the night, and a pattern of swallowing. There are a lot of factors to malocclusion, to the bad bite. And please tell me what strategy, how you approach that problem, what strategy you use for children when what they would not end up as adults with the sleep apnea.
Right, right. So, we're talking about bad bite, and the bad bite is a manifestation. It's kind of like this is the result of the development of an individual who is functioning a certain way. So when we look at correcting bad bites, we're not just correcting the physical structure, we're also looking to correct the function. So when we look at physical structure correction, we're looking at orthopedics and orthodontics. So many of our patients are very familiar with orthodontics because we can move teeth around, and a lot of people probably have orthodontics in the past, and probably
Most of
relapse.
the people.
Right.
And
So
sometimes I love to mention that many times, not just once, let's say 3 times, and it's
that's
all relapse.
that's right, with a relapse. So
Wondering why.
in addition to the structure and correcting the structure, there's also function. So I equate this to something like, if we get any kind of, if we have a leg, for example, and we need to have something done to the bones of our legs, or maybe to our knees, to a joint, we know that in fixing that bone or in fixing that joint, we're correcting the structure, but we also know that we're going to go through physical therapy in order to um, optimize the function. We want to strengthen the muscle so that the bone or the joint doesn't go bad again, because the muscles are what's supporting it. So it's the same thing here. This is bone and joints. So when we're correcting the bone orthopedically, and then we're moving the teeth orthodontically, the stability of that system depends on the function of the muscles and the condition of the muscles, the tone of the muscles. So there's something called myofunctional therapy, which has been discovered in dentistry a long, long, long time ago. And I think it was lost somewhere. And
Unfortunately,
now, unfortunately, and now we're rediscovering it again, because there's a lot of cases where orthodontics are done, and myofunctional therapy was not addressed. And we know that this is one of the biggest reasons for relapse. So myofunctional therapy function of the system is chewing, swallowing, breathing. Those are the three main functions. So the goal of myofunctional therapy is to really optimize that and make sure that the function of that is contributing to the good bone growth and keeping that good bone structure.
And we appreciate all our listeners, and I really like what comments Amna put. So here comes my functional therapy. So it's very logical. What if you correct something, but your function is not right? This correction gonna become point one again. You're gonna go back to the beginning. That's why even the fixed retainers don't work, and removable retainers they still don't work, and that's very unfortunate. What to look comprehensively on a system just like you do, that's gonna promote long-term result, not only from aesthetic point of view but also from, I would say, health point of view. What it can lead to some other changes which will affect general health, such as a sleep apnea. But that's I want to.
That's yeah. So that's the function, right? And then correcting the structure, we're talking orthopedic correction. We're looking to correct the bones first, the bones of the jaw. So expansion is one of the biggest tools that dentists have. And also, believe it or not, in children, we're starting to do aligner therapy. So clear aligners are being used to help open up space in kids, because kids have a lot more softer bones, and combined with growth, we can achieve a lot more with a lot less. So we're using a lot of modalities now, and exactly what you're saying about personalized medicine and personalized care, we are targeting it to the patient, to the child. I have a lot of kids that are already undergoing speech therapy, and we know that that is all part of this whole presentation. It's a sign that there might be an airway issue or a dysfunction in the jaws and in the tongue and the muscles associated with breathing and speech. So if my patient already has a speech issue, and their tongue can't move around very well, the last thing I want to do necessarily is to place an expander on the palate and take up more room, because then that child can't speak it very well. So if we're able to start early enough, we have other options, such as the aligners, which are wonderful, and it allows the expansion, the growth, and of spaces between the teeth, but it also allows the freedom of the tongue to be able to go on the roof of the mouth, and create those patterns so that they can speak properly.
Oh, I love it. I love how you connect all the dots in the speech therapy and the breathing. This is it. That was truly great. And as a practitioner, I see the parents come to me and they laugh how no spaces, child have no spaces between the baby teeth, and I'm wondering where the permanent gonna fit. It's no space, and child has black circle under the eyes and kind of tired, and the teeth, instead of top teeth overlapping the bottom, they fit edge to edge, or sometimes with a cross bite.
That's
you know
right.
but that's kind of it's kind of out of the context. But if you look at the problem comprehensively, you would see what function did to the form, and you have to address from foundation up. You have to really build this beautiful building which called health. And I love
Well,
what you do that.
thumb sucking
Yeah.
or pacifier use, that's another function that we know can affect the form. And nowadays we're understanding that some children suck their thumb as a means to open up their airway. So a lot of the kids now that are sucking their thumb for a longer period of time, and the parent is having a hard time stopping that thumb sucking, it could be that the child is creating their own oral appliance to breathe better.
No,
This is
but
their oral appliance.
nature is so smart. No, you absolutely right. For so many years of doing medicine or dentistry, I cannot, I'm still fascinated by the nature, what nature can do, and how we have that survival mechanism to to continue breathing. That's absolutely fascinating. But that being said, that brings me to the next question. I'm absolutely inspired by the ASAP pathway. I think that's, towards my point of making the gap smaller between medicine and dentistry. You create such a great resource for the public and for the dentists to educate themselves about pediatric airway management, because really, after dental school or even after the residency program, we graduated from the best residency program in New Jersey. I had no clue about that. And I've been working in a residency program. I've been teaching my students, great dentists. They already graduated from dental school, and I talk to them about, sleep medicine and pediatric sleep medicine. They know it exists, but where do you start? How do you start? And I think the resource what you create, it's really great answer to a lot of questions. And I love what public can approach it, and specialists and maybe doctors can approach it, and some other people who are in the world of sleep. I'm talking about the hygienists and sleep technicians, a lot of people who we're kind of on the same planet. We're trying to fight the same problem, interrupted sleep, problem with the sleep. Can you please tell us the story about ASAP pathway?
So ASAP pathway is an acronym, ASAP, right? So like as soon as possible. But what we
Yes.
well, what we have for ASAP pathway is airway, sleep, and pediatrics. So ASAP. So airway, sleep, and pediatrics. But we kind of played on the words ASAP because we want to address these kids as soon as possible. Because we know that if children have airway issues and they're not breathing very well, we know that the development of everything in their bodies are being affected. We know that there could be a 10-point decrease in the IQ of kids. We know that their brains are not the same, if they're sleeping well versus they're not sleeping well. Socially, behaviorally, a lot of these children are different. I have a child, one of my patients, she's 12 years old, and she still wets the bed at night. And she's been invited to many sleepovers, and she's embarrassed, and she can't go. So a lot of her friends are just wondering what's going on, whether she's antisocial or she has anxiety about being separated from her mommy, and it's not that. It's just being embarrassed because she doesn't want to wet the bed at her friend's house. So it's hard to participate in life events sometimes, if you don't have if you're suffering from all of these things. I have other patients with asthma, that can't physically do gym. They can't participate in gym. And a lot of the kids are having fun, and they have to sit out on the side and kind of watch them. So a lot of the kids are kind of suffering now. So we know that there's immediate detrimental consequences to the child, and there's also future consequences with IQ and behavior and all of these things. Health of the body, we know that it makes the person have a higher risk of cardiovascular disease, an increase in inflammatory response in the body. So like all of the arthritis, Alzheimer's, all of that stuff play a role. Inflammation plays a role in all of those conditions. So we know that a child, if they're starting out, they have airway issues already, that body is going to be more prone to growing into an adult that is more at risk for these conditions. So there's immediate consequences, and then there's also long-term consequences. So when we talk about ASAP, we want to address it ASAP because we know that if we are able to address and correct ASAP the child's condition, then that child can grow into a healthier, better adjusted adult. So
This is great. I think it's so important. Now, thank you very much, Dr. Weddle, for such a great answers, and I learned a lot. I would like to ask you for the practical tips for people who listen to us in the recording or alive. I would like to ask you, what would be good tip for pediatric night sleep, for good sleep for the children, which means good sleep for adults? Can you please tell us, in a sense of what type of food to eat, what supplement to take, what regimen actually to build to ensure what's child sleep well at night?
So all of these things are considerations because we know that airway issues and sleep, they're all multifactorial. Everything contributes. So when it comes to the diet and the exercise, we're talking personalized things for the child and for the adult, right? So I can't give exact recommendations, especially for vitamins, but I would say definitely look into these guidelines. You're going to want to stay with more whole foods, less processed foods, because the more processed they are, the more it interrupts the metabolism, the more it also interrupts the rhythm that your body has set of sleep and awake. So that's one thing. So diet. The other thing about diet is also the consistency of the foods. We know that the more processed the foods, the softer they tend to be, and the less processed it is, the more hard. Like vegetables are crunchy. So chicken, if it's processed like a chicken nugget, it has no bones. But maybe if you're gonna get regular chicken, you can eat it off the bone. So you're gonna want steak, so things like that. Or if you're vegetarian, you want something plant. If you're plant-based, you want something that has some kind of fiber, some kind of toughness to it, so that it requires that your muscles are going to work, because that's how we
Very
grow,
important.
right? So we were talking earlier about somebody who's a carpenter, maybe, who has a hammer and they're hammering away with their right hand. Well, that right hand, because it's doing the work, it's going to have good musculature, it's going to have good bone density. If the left hand is not doing anything, then that left hand is not going to be as developed as the right hand. So when we're talking about the development of this whole area, we're talking about the exercise that we're going to put it through, not just the nutrition that we're putting in the body to help grow it, but also the exercise, the musculature, what work the muscle is going to have to do in order to develop. So that's diet. And then exercise, we know that our bodies want to move, and if the body is not tired at night, then it's going to be harder to sleep. So diet, exercise, those are the two main things. In our children, actually, and in our adults now in our society, we know that there's a circadian rhythm, right, that happens within our bodies, and that circadian rhythm is dictated and affected by light. So screen times is very, very important to manage, especially right around bedtime. So no screen time for like 3 or 4 hours, I would say, which is a lot for kids sometimes. A lot of times our children fall asleep, even adults fall asleep to watching TV, but that's actually not very good for a good night's sleep. um, so those are things that we can do. We know that vitamins also affect our rhythm. So food with nutrition is great, but living here in the Northeast, we know that vitamin D is hard to come by because we're always living indoors. So going out in the sun, maybe just 10, 15 minutes with no sunscreen necessarily, because sometimes sunscreen can affect the way our skins will absorb the sun's rays, and it won't allow our bodies to create the vitamin D that we so need to create on a daily basis. So here in the Northeast, I would say consult your physician and see what kind of vitamin D. It's a good idea to check your vitamin D in your blood, because even though you're taking supplementation, sometimes it doesn't absorb very well. So just check it out. Yeah.
Yeah, this was great. Thank you very much, Michelle. We're so happy to have you here, and thank you very much for giving us so much knowledge. We're looking forward to have you back. I really appreciate your time.
Thank you so much for having me, Marina. I love talking to you and I love talking about this subject. Yeah,
Thank you.
my pleasure.
And I'm gonna put all information in the chat, what people can find you, and maybe if they ask me the questions, I will definitely find them the answers from you. Thank you very much.
Thank you.